Hi, everybody. I'm San Francisco Mayor London Breed, and I'm joined here today by our County Health Officer, Dr. Tomas Aragon. Dr. Aragon is a native San Franciscan. He's been with the department for over 10 years, has been responsible for all of the decisions that are being made to keep us all safe and healthy. Just yesterday, we made an announcement about a safe reopening plan. And I want to talk a little bit with Dr. Aragon today about the kinds of decisions, the very hard decisions as a public health officer that he has to make to keep us safe. I also want to touch a bit on how are we going to reopen safely, why the decisions around masking and locations that are being open or opening at the time that they're opening. I know so many of you have so many questions, and also there's a lot of uncertainty. So today we want you to meet your county health officer. We want to dig deep, and we want to really talk about why the decisions that are made are important for us to follow and what we can continue to do to remain safe and healthy in San Francisco. So at this time, I just want to welcome you, Dr. Aragon. Thank you so much for your work. We know that we've been working hand in hand, and you have been specifically working hand in hand with other county health officers throughout the Bay Area. A lot of hard decisions that we've had to make, and every step of the way, I know you focused on public health. So let's just start from the beginning. Because I know that initially we were having discussions about the need to start to reduce the number of people at events. And then finally we got to this shutdown and it was necessary. So tell us a little bit about how the decision was made to really get to this point where we are now.
So that's a really good question. And if you remember early in March, everything was moving incredibly fast around the world. We saw what was happening in Italy. We saw the number of cases, the number of deaths, and also beginning to understand some of the information that was coming out of China. And so I think that I'm hearing a little echo there. So I think that that information that was coming out and seeing how other countries were responding, the United States had not been there yet. We did not have a surveillance system. And so as we started shutting things down, I think that really set the mindset. We were incredibly supported by yourself. Elected officials in the Bay Area were very supportive of everything as we move forward. And I think that's what really set up the ability for us to collectively make a decision, because we really felt we had the support of elected officials and also of the population. And so that was on March 16th that we got together and decided collectively to do the shelter in place.
Yeah, and I remember those days because I remember as I was given numbers, arbitrary numbers of closures of events, I got to a point, I ran out of a little patience when I felt like, well, why is it 100 versus 50? Or why is it 1,000 versus 500? We got to a point where we knew that in order to protect as many people as we can, we were going to get to that point. So why continue to kick the can down the road? And so we appreciate your support and the guidance you provided on helping us to make that decision. And so tell me a little bit about what exactly is the role of our county health officer? Because I know folks are, I am making decisions, I am leading the city, but I'm getting a lot of my advice from our county health officer, that's you. So tell us a little bit about your role in public health for San Francisco.
So the way it works in California, authority really exists at the state level. And in California, we're fortunate. What they do is that every health jurisdiction has a physician health officer by law to implement legal authority around health issues throughout California. And so that's existed for many, many years. And so it's allowed California, because it's a big state, to have policies that are customized to the issues that people are facing. San Francisco is very unique because we're a city and a county. Whereas the county health officer in Los Angeles has to deal with 88 cities, I only have to deal with one city. So it makes it easier. It actually makes it easier for San Francisco to be much more agile in responding to public health threats. And I think that's one of the reasons why San Francisco has been a leader in public health, is because we're very agile. And so that's basically how it works.
So yesterday we made an announcement. working with the Economic Recovery Task Force, the Department of Public Health, we focused on, and Carmen Chu, our assessor recorder, who's been really leading this effort, we talked about ways to reopen safely. And so we announced this plan. And of course, it was really challenging because even though from your perspective, you see the numbers are changing, the testing is going up, the PPE, and we're in a better place, people really are frustrated. They feel like this is moving too slow. And they don't understand why one business versus another is able to open, or why museums can't open, or why did we pick the things that we picked to open? Because again, this is not just about me wanting to go to the hair salon. This is about the fact that those folks who have hair salons and places that have direct contact with people, they have no income coming in and they are struggling. And so can you talk a little bit about the decisions that you're making? I mean, I believe they're too conservative. You believe that they're probably a little bit faster than what you would like them to be. Help us to understand what goes into making a decision as to who is reopening and why, based on our SF safe reopening plan.
So one thing to appreciate that we have never experienced this before. So while it was in some ways straightforward to shut down the economy, opening it up is much more complex because there's so many stakeholders that are involved. And the city cannot act by itself. So we really work with a region and we work with a state. And so we've been working with the state and really making sure that we have smart alignment with the state. The state has some challenges because they're going to come out with recommendations that's almost a one size fits all for California. So while it may be too slow for Humboldt County, it may be too fast for San Francisco. We face some very unique vulnerabilities that other cities don't face. We're the second densest city in the country. We have, when commuters come in, we have a lot of folks. And so while we have made incredible progress, we want to lock in those gains. We want to lock in those gains, and we want to move forward in a way that's going to be safe for everybody. We're really committed to not moving backwards. And I think that's, as we learn more about this virus and how it acts, we want to make sure that we move forward, not backwards, and we move safely in alignment with our region and the state.
So Dr. Aragon, here's my pushback on that, because for example, in grocery stores where the system exists, or even Target is open because it has a component of a grocery store, you wait in line, you're wearing your mask, only a limited number of people are able to go in. There's no rules around what you can and can't touch, even though people are, for the most part, socially distancing themselves within those stores and those locations. And they're not probably touching as much. They may have gloves. So why is it that, like, for example, bookstores and other retail businesses, why can't they do the same thing sooner rather than later?
So what happened is that we realized is that to open up the economy, we had to phase things in. So that's really critical. And what the state did, the state provided an overall framework, and then the Economic Recovery Task Force, they applied criteria to identify the areas that had the highest risk and the lowest risk. And what you do is you start with the lowest risk areas, and you just slowly move through those phases. And one of the challenges is that some people in the later phases will say, well, I can do that safely. And that may very well be true. It's just that we can't do everything at once. And that's really the challenge, is that even though some industries in later phases could in theory do things safely, we have to phase it out so that we don't move too fast. The next thing we do is that we give it about 2 to 4 weeks to really understand the implications of what we just did, because we don't want to do too much and then have to move backwards. Just to give you an idea, there's already 2 counties, one is Sonoma and the other one's Lassen, where they felt they moved a little too fast. Sonoma is slowing down, and Lassen actually pulled back from one of their reopenings. So I think it's really critical for us to be mindful and to make sure we have enough time to make sure that we don't get ourselves into trouble, check the numbers, and then continue to move forward. And I think what we do know from the 1918 influenza pandemic, those areas that moved at a good pace did better economically because they did not have a large second wave of infections.
So let's talk about that because, you know, while we are averting one public health crisis, we are unfortunately creating another. And so I know that depression is setting in with some people, folks who have no income and no ability to take care of themselves and their families. We know that domestic violence, suicide, child abuse, all these other things as a result of what we see happening. And it's even worse for people who are low income and poverty. Right. And so on the one hand, we are lowering the curve and really been a leader in that effort. But there's another public health crisis that's brewing as a result of the decisions that we're making. How are we expected to sustain this? How are we expected to continue to live like this while, you know, there still are a lot of people suffering from something that's a different public health crisis?
I agree. I agree with you completely. And I think that's really one of the challenges. And, you know, when the health officers talk about these issues, we recognize that when you look at health in its complete way, the way you're describing, we absolutely have to take into account those trade-offs. And that's for me, I can just tell you my personal commitment. I feel like I'm now on a mission. I'm on a mission to really to get us to open up as safely and as quickly as possible, because we know that we have to have people get back to work. People have to get back to seeing their doctors. People have to pay the bills, pay the rent, pay for school. All those things that all of us need are absolutely critical. And I think that's one of the reasons why some people say to us, why are we being so strict? It's because I want to keep moving forward, and I completely appreciate everything that you're bringing up, and that's what makes these decisions very difficult.
Yeah, and when you think about it, for example, what about the seniors who are living in isolation and need to see their family members? What about the kids who are maybe, you know, only children who haven't played with another kid for this long? Like, this is not sustainable. Like, emotionally, right. It's having an impact on people's lives. And so I think that it's going to be important that we give guidance. Like, what kind of guidance? Because the fact is, I think people for the most part are, you know, going to see their parents or going to see their relatives or scheduling play dates. And I know we have said that that is not a good idea, but people are probably going to do it anyway because they have probably had it. And I honestly don't blame them. So tell us a little bit about how people can do these things safely, because I think human behavior, we can't help ourselves. We want to be around one another. We want to interact with one another. And I get that we want to, you know, stop the virus, but we also have a, you know, if my grandmother were still alive, she was in Laguna Honda. If she were still alive, it would kill me to not be able to go up there to see her. It would literally kill me. And so I just need you to help us understand, how are we going to be able to see our relatives and our friends and other folks safely? What's the solution to this?
So you're bringing up a really important issue, and we're actually, the health officers right now, and actually the health department right now is actually going to design new strategies to bring people together, to bring households together for just the very reason that you're saying. And so some ways we feel like, okay, we dodged this bullet, but now we have time to actually do this right. And you'll be seeing hopefully over the next week, we're going to be coming out with recommendations for the region on how families, just the way you're describing, can really come together. But we want them to really think through and make sure that they do it safely. So we want them to be aware of the physical distancing, wearing the face covering, making sure that they're washing their hands, and if they're sick, to make sure they get tested. So that's actually right around the corner for the very reasons that you're mentioning. It's really important for social connections to stay strong. And so we're moving in that direction, and you'll hear more about it in the next few days.
Because we also know that, for example, there's going to be limitation to our summer camps, the limited capacity. There's going to be limited capacity for childcare. So what about those families whose kids don't make it into childcare or summer camps? What are they going to do with, you know, their children? How are we going to make sure that, you know, they have access to other kids and they have access to the ability to, you know, be around one another and grow with one another? I just, you know, again, I think, you know, I noticed that I see a lot of teenagers
Right.
walking around together with one another. And, you know, they're wearing their masks, some of them aren't, but it's really tough. So I do think it's going to be important that as we continue to try and push forward more health directives, if we expect people to follow them, you know, we got to also think about human nature,
Right.
and providing them with safe guidelines to do so. So that, as you said, we don't see a surge and we don't go backwards. So I know folks are going to be looking forward to those guidelines, because this is going to be critical to our ability to meet the goals of waiting for things to open and to get back to work and the other things that we need to do. And I guess I want to get into face coverings because, you know, I mean, what people are hearing from me too is like, I'm expressing the frustration of the people of San Francisco because, you know, we know it's a fluid situation. I know people are tired.
Right.
And it's hard. It's really hard to sustain this. And now there's another a face covering requirement. Can you tell us about that requirement? And can you talk a little bit about why? Why is it now 30 feet? Why, you know, are the requirements a lot, it seems stricter? Can you talk about what the new requirements are around face coverings and why?
Yeah, so let me just really quickly just give a very quick background and why we're very concerned. So when you think of COVID-19 disease, we know that it's more infectious than the flu. It's 10 times more deadly than the flu. And so we're very concerned as we begin to open things up, how do we do it in the way that we continue to move forward? So that's the first thing. Because there's no vaccine and really there's not really effective treatment, we only have a few tools available to us. One of them was the hammer, which was shelter in place. We don't want to go there. We want to move away from that. So we only have a few things left, which is physical distancing, face coverings, and hand washing. And so now we want to make sure as we lift shelter in place that we're doing the best we can in those areas. Just to give you an idea about face coverings, so we know from the science that's emerging and from the mathematical models that have been developed that if 80% of people wear face masks or face coverings consistently, we can prevent outbreaks. That is humongous. And so it's really important for us to appreciate that. The countries that are being successful in keeping their economies open are the countries that have universal face coverings. And so we have to, for the next year until we get a vaccine, this is only temporary, it's not gonna be forever, until we get to the place where we have a vaccine and we can safely have everybody, most people immune. This is the bridge that's gonna get us there. It turns out that the risk is very low, but the benefit is very high. And it's gonna allow us to have more movement, families to get together, and over time, as the infection goes down and the risk goes down, more and more people are gonna be able to come together. So it's gonna have a big impact.
So why 30 feet, I guess, compared to initially 6 feet?
So here's the way that I want you to think about it, is every time you walk outside, whenever you go outside the home, and there's a good chance that you're gonna have contact with people who are not part of your household, we want you to have a face covering. So that's the first thing. Easy to remember. When I'm outside my home and there's a good chance that I'm gonna have contact with people who are not part of my household, then I should have a face covering. And basically there's two basic scenarios that happens. There's when you're moving around, walking down a crowded street, maybe you're hiking on a path, and then all of a sudden people come upon you and they're not wearing a face covering, you're not wearing a face covering, and everyone's embarrassed because you're almost on top of each other and no one's wearing a face covering. The 30 feet is really about being mindful as you approach people. As you're approaching within 10 yards, go ahead and put your face covering on. So the 30 feet is really about using common sense as you're approaching situations where you have enough time to go ahead and put your face covering. So 30 feet, some people like to think of 10 yards if you like football or soccer, or think of 2 average cars. So when you're walking down the street. The other one is when you're stationary, and this is really the more common one that you're talking about, and that is 6 feet. So if you're in the park with your family and you're away from everybody else and you're eating lunch, having a picnic, you can go ahead and put that down. This morning when I was leaving my house to work, across the street was a father and a daughter. He was holding her hand and they were walking the dog. They're totally by themselves. They didn't have to wear a mask. And that's exactly how it should be. We give people plenty of opportunities to go ahead and pull it down so they can get fresh air. As long as you're not close to anybody, go ahead and pull it down so you feel comfortable.
So one of the challenges we've had are runners. I noticed it too. For some reason, there are people who are running, and I would say, 50% of the time they'll get out of your way and they'll move away from you, but sometimes they just run right past you and so tell us why that, because people are saying, well, I'm a runner, I'm not going to run with a mask on. That's ridiculous, right? And I'm not a runner, but I know that it's hard enough to breathe in a mask sometimes. So how do you expect people who are outdoors doing exercise to wear a mask? What are the guidelines that you think they need to follow?
Yeah, so you basically follow the same common sense guidelines. And so I'll give you the example that I do. So I like to run up to Twin Peaks. And so what I do is I actually just have my mask right here. And most runners actually, and this is actually some of the runner magazines, what they recommend to folks is just run around where there's no people. When there's nobody around you, you don't have to have it on. But when you're running running by a family, let's say, go ahead and put it on. That's the 30-foot rule, the 10-yard rule. Go ahead and put it on as you pass them. And when you pass them and there's no one else around you, go ahead and pull it down. So we're trying to make sure that it's really common sense so that people do it in a way that's respectful of other people as they come close to each other and come near each other for a short period of time. The 10-yard rule is to remind them, slip it on, and then when you're past them and you're alone again, go ahead and slip it down. So we're not expecting people to wear it the whole time.
So if I'm at the park and I'm having a little picnic in one of my circles, then most likely I can leave my mask off.
Correct, exactly, yes.
Okay,
exactly.
All right. So I get that there's a lot of confusion there, and it sounds like we're telling people, be on your best behavior, use common sense, don't police other people, just do the best you can. We're all in this together, and we want to make sure that we keep people safe, we want to keep ourselves safe, and we want to keep other people safe.
Exactly, and I think the way you described it is perfect.
Okay, so here's the other question. Say, for example, we see the numbers blow us away and surprise us and go down considerably. Is there any chance that based on the timeline of the dates of reopening, is there any chance that we could see that timeline moved up or things moved out of the timeline and up into the forefront?
So you mean moving the intervals closer? Is that what you're saying?
So for example, if we see all of a sudden over the next week, we see a sharp decline, right, in the number of hospitalizations, and we already see testing has gone up considerably. We're doing a great job with testing. So we see a sharp decline in whatever you need to see a decline in. All of a sudden, there's of course a strong desire for people to see more happening faster. Do you think that there's a possibility that this safe reopening plan could be moved up so that some of these things are available sooner rather than later? I mean, I'll give you a perfect example. Museums, right? It's not just because I want to go to a museum, but I think about the people who work at the museum, the security who works at the museum. And the fact is, you don't need to touch anything at the museum. And there's ways in which we can guide people in the restrooms and so on and so forth. The Academy of Sciences, they're furloughing employees. But these are locations where there's a real possibility to limit capacity, and they're in phase 3. So I'm just using them as an example.
Yeah, you're asking a really good question, and I think for us, one of the way that we've been thinking about this is because San Francisco is just, we know that we're just higher risk. That's sort of the baseline, and so that's why we've been really anchoring to the state roadmap, and so the state roadmap is moving very fast. And it's very likely for some of the things that you're mentioning is very likely to allow more and more of these things to happen. And so if the state allows that to happen, we will look at, we will look, if the state starts moving faster, we will look at our numbers. And if it looks like we can do it, then we're going to go ahead and implement it safely in San Francisco. So that's what we're allowing the state to really be that monitor, because they know they're going fast.
Yeah, and I want to just express my appreciation again for your leadership, and also for the timeline and giving the people of San Francisco a lot more certainty about what to expect. It's not what we want, of course. We want more, and I will continue to push for more. But you know, I appreciate the opportunity to have this open discussion. You know, I just want to say to the people of San Francisco again, thank you for all that you are doing to help us through this. The better that you follow the guidelines around masking, around social distancing and hand washing, the safer we will be faster, which will give us an opportunity to do more. And I know we're asking a lot of the people of San Francisco, and we appreciate that for the majority of you, you follow these protocols. And we also are well aware that some people are really suffering. And that is at the forefront of our mind when trying to push for changes faster. But we also want to make sure that we are safe and we don't roll back the gains that we've made so far. It's difficult. It requires a lot of sacrifice. It's easier for us to ask you to do it than I know it is for you to actually do it. But we appreciate everything that all of you have done to take part in helping to keep San Francisco safe and healthy. You know, I know it's one thing to be a leader. It's another thing to be the person who's suffering and stressed out and worried about their next paycheck and whether or not they're going to be able to hold on to their shop or hold on to their apartment after this is over. So we are keeping those things in mind, and I appreciate the work that you are doing, Dr. Aragon. Thank you so much for joining us here today. Please feel free to continue to submit your questions. These conversations are really about trying to get to the heart of the questions and concerns that people have, rather than to do just a regular press conference. This is an opportunity for us to have a discussion about everyday questions that people have. You can definitely call 311 for testing or other questions and concern, or feel free to email me, Mayor London Breed at sfgov.org. And thank you all again for joining us here today.
Thank you.
Thank you.